humerus, and this is the long bone. It has upper end, shaft, and the lower end. Upper end has globular head, which should be faces medially for the side determination, and lesser tubercle which should be facing anteriorly, and greater tubercle which should be facing laterally. Here is the anatomical neck surrounding the head. This is the head is the surgical neck, and 5 cm below the surgical neck is the morphological neck. This is the lesser tubercle, this is the greater tubercle, and this is the intertubercular sulcus between the greater and the lesser tubercle. There is 6 parts in the upper end. This is the anatomical neck surrounding the head of the humerus. This is the lesser tubercle which should be facing anteriorly for the side determination, and greater tubercle, this is the greater tubercle which should be facing laterally. So this is the right side of the humerus. Intertubercular sulcus, the sulcus between the lesser tubercle and the greater tubercle. Surgical neck, here is the surgical neck, and morphological neck. 5 cm below the surgical neck is the morphological neck. This is the shaft, and shaft has upper half and the lower half. Upper half is rounded and the lower half is triangular, and there is 3 borders on the shaft. This is the anterior border, this is the lateral border, and this is the medial border. This is the lesser tubercle and the greater tubercle. Between these tubercle, this is the intertubercular sulcus, and this intertubercular sulcus has lateral lip and the medial lip. This lateral lip forms the anterior border, this is the anterior border, and this medial lip forms the medial border, and this is the lateral border. Between anterior border and the lateral border, there is the anterolateral surface which has deltoid tuberosity, and between the anterior border and the medial border has floor of the intertubercular sulcus, and this is the posterior border. There is the radial groove, which is also called spiral groove. Here radial artery and the profunda brachii, radial nerve and the profunda brachii artery runs through it. In lower end, this is the capitulum, which is the articulating surface for the radius. This is the pulley-shaped trochlea, which is the articulating surface for the ulna. And above trochlea, there is the coronoid fossa, and above capitulum, there is the radial fossa, and posteriorly, there is the olecranon fossa. This is the lateral epicondyle, and this is the lateral supracondyle ridge, and this is the medial epicondyle, this is the medial supracondyle ridge. There is 2 articular parts. This is the capitulum, which articulates with the radius. This is the capitulum, and trochlea which is pulley shaped, which above which is the coronoid fossa, and posteriorly there is the olecranon fossa. This is the trochlea for the articulation of ulna, and non-articular part. This is the medial epicondyle, and this is the lateral epicondyle. And above medial epicondyle is the medial supracondylar ridge, and above lateral condyle is the lateral supracondylar ridge. And there is the coronoid fossa above trochlea, and this is the radial fossa above capitulum, and posteriorly there is the olecranon fossa.